HRS has been around for 12 years. We started with congestive heart failure in the home health space. So congestive heart failure, hypertension, atrial fib, and cardiac surgery are the top 4 use cases.
The last 3 months of the year of 2023, we had a 0% readmission rate for our hospitalizations. But even more than that, in the just over a year that we had HRS, we actually only had a 3% admission rate, which is huge. I think this is one of our very typical patients, actually. It sounds like such a great story when it's written down. I'll just read it really quick. The following are the data from the last year of my miraculous and unimaginable recovery from total catastrophic heart failure. This is really very typical of patients that we have. So he was discharged from the hospital, status post an acute heart failure event. He was a candidate for the program. Really, we try to give all of the patients that have been discharged from the hospital one of these kits. There's a lot that goes into taking care of heart failure patients. They're very fragile when they come out of the hospital. So these are patients that we just really have to keep a close eye on. And that's exactly what home monitoring gives us.
Is really looking at what sort of tools are already embedded into HRS that we can leverage. They have a really great clinical team that we work with regularly. So if there's ever questions on setting a new care pathway.
I was just thinking about the texting. That's one thing that we actually really enjoyed about HRS for sure, is we would be watching our patients. And if you know that this patient always has a low oxygen saturation when they don't have their oxygen on, it was very easy to respond back and say, hey, put your oxygen on and check it again. Instead of having to make those phone calls, that texting option was something that really saved us some time too. So our goal was to keep about 80 patients a month on HRS, and I think we did a pretty good job of it. You can see like March of 2023, they got a little carried away. We had 108 patients. That was a little bit too much for our nurses to try to look at 108 patients every single day, but we managed about 80 patients pretty well. We're monitoring them 5 days a week, from 8 in the morning until 5 at night. And that if they need a phone call after hours, that they need to call our after hours physician.
I think one of the really great things that I hear as well from the patients is that they're really learning a lot about themselves and how to care for themselves through this. Again, it's just part of the care continuum. And so, Susie and her team have done a great job of helping them to be more self-sufficient as well.